I think something that's very significant about Firelands is that where other healthcare institutions in recent years have combined with larger institutions from out of their area, Firelands has done just the opposite and has taken the best of our community in terms of healthcare and have combined what used to be 3 hospitals into what now is one high-quality healthcare organization known as Firelands Regional Medical Center. And I think that's very unique not only in our region, but also around the country. And it makes us a local, community-oriented hospital that is run and where decisions are made by people who live and work in this community. And I think that's very unique and sets us apart from many other healthcare institutions. For people who love the water, we have every type of recreational sport you can ever ask for, whether it would be fishing, sailing, boating of any kind. And we have facilities here where people can visit the Lake Erie Islands. They can provide travel opportunities by water that you can't get from Cleveland or Toledo or Detroit or any of the larger cities that are in our region.
Just the quality of life here in Sandusky, you're not going to find a better quality of life. From the cost of living to the things that we have available for us, recreation-wise, from Cedar Point to the islands to the lake, you're not going to find a better place in the country to come than Sandusky, Ohio.
The region surrounding the hospital is also very nice. My family loves being in Sandusky, and there's the proximity to Toledo and Cleveland. If you really want to have the big city feel, you can just hop in the car and go to Cleveland. Yet you can come back home to Sandusky, and it's a nice small town feel with a large hospital.
I had the opportunity to move from Southern California, and I came back home. I actually grew up in Central Ohio. I remember coming up to Sandusky when I was younger, and I thought it'd be a great place to raise my kids.
So we feel that from a quality of life standpoint, fun is very important, and we can offer that to the people who live and work at Firelands.
For the quality of life, the quality of care at Firelands, and really the people that you get to work with every single day. Because when it comes down to it, those are the people that really make the experience worthwhile and make you want to come to work every day. And it's a wonderful place to be.
It was a great area just for family life, being close to the water, it being more of a tourist area but not very commercial. Gave us a lot of options in terms of what we wanted to do for the kids and what we wanted to do with the family.
There are a lot of great advantages to living in the area where Firelands is located. First of all, people look for education for their families. I think there are many educational opportunities here, not only for younger children and high school age children, but also children who would graduate from those schools and want to have higher education. We have a local branch of Bowling Green State University that is very near Firelands. We cooperate with them in helping train people who work at Firelands. So if young people want to consider healthcare careers, they can do that at home.
Sandusky in Ohio, I've had a lot of different experiences at a lot of different hospitals and medical centers across the country. I've worked on the East Coast. I've worked here in Ohio before. And I can honestly say that when I came back to Ohio, I often said, don't take Ohio for granted and don't take the Sandusky area for granted. Ohio has outstanding health care. We have great performance here at Firelands, but Ohio overall has some outstanding healthcare systems within it, and we work together with many of those outstanding systems.
We also have a lot of quality of life in terms of culture, in terms of things that people might like to do. They can be interested in the symphony and see a symphony in downtown Sandusky, or they can go a very short distance away within an hour's drive and see the very famous Cleveland Symphony or Toledo Symphony, and not many places can say that. We feel that if people are interested in rural community life, living out near farm communities, we have those nearby. So again, the quality of life style that serves people in the tranquil rural setting, we can offer that.
I felt at home instantly. I think that the Firelands staff treat each other as if we're members of a big family. We have a very professional staff. I feel comfortable that any of the surgeons here are of the quality that I would feel comfortable with my family members coming here for their care.
Well, the benefit of being on the medical staff at Firelands is that number one, I get to know the specialist very well, and even in the outpatient setting, if I have a question or concern, they are very approachable. I can call them in the office, or I can call them on their cell phones and get a quick 20-second question answer, so I can provide better care to the patients. When they are admitted, the lines of communication are always open. They keep in touch with me as the primary care physician, and I can also ask them questions and see how the progress of the patient is going.
And this place has got some outstanding internists and surgeons. We got an outstanding ER department, we got an outstanding HEMOC department, and outstanding as far as nephrology, everything across the board, all the different specialties and subspecialties that I could want is here, and also they're quality people.
I believe that Firelands offers many unique healthcare delivery opportunities for the people who need the services that we can provide. First of all, we have a wonderful physical plant. We came together from 3 hospitals into one so that we could pool all of our community resources into a state-of-the-art facility that is really beautiful and larger than what you might expect in a community our size. In addition, this type of first-rate, state-of-the-art facility helps us attract the highest quality professionals in the healthcare field, whether they be physicians, technicians, nurses, anyone who might be interested in quality healthcare delivery to a community can find that at Firelands, and I think promote their own professional goals through delivering healthcare at Firelands. So I think that's wonderfully unique and sets us apart from many other organizations.
Our services here, including cardiovascular medicine, our critical care services are really top-notch, and we have some of the highest quality subspecialists in the area.
It's worked out nice for me. I've always worked in small towns, but with the small towns came really small hospitals, and Firelands has been a big advantage in terms of having a great hospital system, as well as all the specialties that are needed. So it's worked out really well for me, especially me being at an off-site office. It's hard to get to and from the hospital, so that's worked out really good.
I think Firelands is a special one because of the staff that's here, and when I say staff, I mean from the board of directors all the way down to the medical staff and the support staff of the medical center. This is the most engaged board of directors I've ever worked with, and I've worked with a number of them in my career, and also the most engaged medical staff that I've ever seen. Very involved in how this medical center is run, governed, and the success that we have.
I'm very happy with my decision to come here. From a personal, professional, economic standpoint, things have kind of worked out very well for me. And so it's also been nice too to see the institution grow. I've been, part of that, and that's been an enjoyable part too. It's a good-sized institution. I think one of the things that people miss is they think, geez, it's a small little hospital in a small town. We're rated for over 300 beds.
We have a unique collaboration with University Hospitals Cleveland, and it's a good partnership that we have, that we can still be fairly independent and manage our patients, but we're able to be part of our national standards and really implement quality measures throughout the region.
I'm definitely happy with my decision to practice at Firelands because, as I mentioned before, I'm very familiar with the hospital and the personnel there, having trained as a medical student and as a resident. It's a very supportive environment. There is good cooperation between the nursing staff and the physicians, which to me is very important since we're all working together to take care of the patient.
Finally, I believe that all of this combines to allow us to deliver health care to people close to their homes, close to the communities where they live, close to where their families can visit them if they have to be staying at the hospital. And so I think it gives a great advantage not only of the people who deliver the care, but also the people and the families who receive the care from Firelands Regional Medical Center.